Around this time of year, it's not unusual for the youngsters to come home from school with a cough or a cold. But in flu season and with an outbreak of the whooping cough in New Brunswick and even some cases in Nova Scotia, some parents are likely now wondering how they can tell whether that cough is something they should be worried about or maybe something not so serious. CTV's Sarah Ritchie has been looking into that.
There's a flu bug going around right now. This is not the annual flu setting in.
In addition to the seasonal flu, New Brunswick parents are dealing with a whooping cough outbreak.
It's very difficult in the first few days to really identify if if you do have whooping cough.
Public Health is continuing to vaccinate those in grade 7.
We also had a memo sent to all parents with children from kindergarten to grade 12.
So far, there have been 47 confirmed cases of the disease in southeastern New Brunswick. Most of them are here in the Greater Moncton area, but public health officials say that number is likely the tip of the iceberg.
There is much more activity that is likely occurring in transmission within the community than the small number that we're seeing.
That's due in part to the fact that not everyone with the disease will present with the characteristic cough. Still, experts say it is distinctive.
I had a child years and years ago that had pertussis, and it was very, very scary as a parent, even as a pharmacist, because there's nothing that will suppress the cough.
If you've been coughing for over a week and you've been vomiting or choking.
Anyone with a persistent cough that lasts more than a week should see a doctor. If you do end up with whooping cough, the good news is that unlike the common cold and flu, it is treatable with a course of antibiotics.
You're contagious for the first 5 days that you're on your antibiotics, so you shouldn't go anywhere near as children under the age of 1 or pregnant women in their last trimester.
Frequent hand washing and good hygiene may help prevent the spread of the disease.
Immunization does remain the best protection.
The number of new cases this month appears to be leveling off. Public health officials say they hope this means the outbreak has peaked and is nearing its end. Sarah Ritchie, CTV News, Moncton.